Hi, I'm Dr. Larry Frieder, and today I wanted to show you a shoulder routine, workout rehab routine that I learned to rehab my own shoulder injury. And you want to first make sure you get this checked out by a professional healthcare person so that you rule out any rotator cuff tears or cartilage tears that might need surgery or some kind of treatment prior to doing rehab. So this is good for impingement syndromes, adhesive capsulitis, or mild frozen shoulders. So the first exercise is doing scapula or shoulder blade walking. So on a yoga mat, it's nice because then you can allow your head to relax and just rest on the yoga mat. So we're going to be walking your shoulder blades one at a time. So maybe you go about 3 feet up the yoga mat and then stepping back one shoulder blade at a time. This really works the serratus anterior muscle, which helps to keep the shoulder back and down so that you have a nice big open chest. And just going back and forth. Maybe you'll do that up and down 3 times, maybe 10 steps up, 10 steps back. So that's a nice one to start. And this is actually a great exercise just for anyone that's sitting, working at the computer, and it helps to bring the shoulder blades down and in. So we're going to go look at the Thera-Tube exercising, but first remember that every one of these exercises involves bringing the shoulder blade back down and in. So you're imagining the shoulder blade, the right shoulder blade, getting pulled down and in, tucking it into the left back pocket. So kind of down and across. So you're kind of pulling them down and in, and we initiate that before every single exercise we're going to be doing here. So let's go over to the Thera-Tube. We're going to start on the top, and this has a little door jamb in it. I ordered this one on Amazon. These are like $9. The blue is, I usually go one step up from the lowest resistance. I think it goes like 1 to 4 pounds and then 5 to 7, something like that. So one step up from the lowest resistance when you're starting your rehab exercise. So for the first one, Lat Pull Downs, stepping back just enough till you feel enough resistance there. Again, starting with shoulder blades down and in, and just pulling straight down. And it's nice at the beginning of each rep to remember pulling the shoulder blades down and in, head above, so you're not kind of doing this kind of thing. So pulling down, maybe you start with 10 to 15 reps, and maybe doing 2 sets of that. You shouldn't have any sharp or stabbing pain here. You could have a little soreness, and that soreness should resolve quickly, or at least by the next day. If you're feeling any sharp pain, don't do that. Check with your doctor. So let's now move this right about here. I kind of go kind of midway between the shoulder and the waist. And the first exercise, we're going to adjust the tension here so that it's longer in the front, shorter in the side. And you're going to end with the wrist in the center of the chest. So doing external rotation on one side, internal on the other. Again, maybe 10 to 15 of these, and then you're going to turn around and do the opposite side, 10 to 15 reps, 2 sets. Okay? The next one, we go back to even pulls, and we just slide these handles down, and we put them into our elbows here, like this. And now stepping back, again, always first, shoulders down and in, and spreading out like this. Remembering Each shoulder goes into the opposite back pocket, nice open chest, spreading out across like that. The next one, bringing the handles back to center, and we go one arm up at 90 degrees, the other straight, and then we alternate right and left, keeping those shoulders down and in. 1, 2, 3, until we get to 10 to 15 reps. The next one is moving those handles down again, stepping away from the door to get some resistance, shoulder down and in, and sweeping the arms straight down, getting from about 90 degrees. Sometimes I'll put my hand here just to remind me that my shoulder needs to get tucked down and in. And just coming across like this, nice good posture, head up above your shoulders, sweeping across like this. And the last one, leaving those handles off to the side, or bring them back to center, and we reach around and grab from the other side, and now we step forward a little bit to get more resistance, and we come forward with kind of a pec exercise. If you're getting pulled back like this, get one foot forward to kind of brace yourself so that that back leg is supporting you and keeping you from getting pulled back. Again, 10 to 15 reps. You could do 2 sets. You can either do a set and wait 2 or 3 minutes and do the second set, or you can go through this whole routine and then do the whole routine a second time. If you're just getting started, it might be better to just do 1 set of 10 reps and just test it out. See how your shoulders feel, see how they feel the next day before you add in that second set. So that's a shoulder routine that I've had a lot of success with. Let me know how it works for you.